This ultrasound study is regarding gallbladder and the bowels that we can easily mistake as calculi within the gallbladder, layered out with the posterior wall of the gallbladder. As for example, in this study, I can, if I am not aware of this very fact, I can very easily label this echogenic area as calculi within the gallbladder layered out with the posterior wall. Which area I am talking about is this one, this bright area. Now you see that in this case we are seeing the posterior wall clearly separate from this echogenic, bright echogenic area, and secondly you will see shadows and movement within this area. So this is in fact the duodenum, a segment of the duodenum or bowel giving dirty shadow, and it's not giving a black posterior shadow as we see in case of gallbladder calculi. So we have to be careful in this area. As for example, now if I keep the probe for some time, it will change its position. You will see ring down artifacts as well as dirty shadow. Movement will be seen in this. This can be easily labeled as gallbladder calculi. See, if I take this position, so now I can easily label this echogenic area, this one and this one as calculi in the gallbladder. And it looks like being in the gallbladder wall, but the fact is, see that they are giving dirty shadow posterior to them, then we do not see black posterior shadow. Number one. Number two, you can see that the posterior wall of the gallbladder is seen clearly. Now what to do? How can we get a clear image? Is that ask the patient, number one, to take a deep breath. एक लंबा साह ले आजे मैं, लंबा साह ले आजे, साह ले के रोको. And when patient takes a deep breath, you will get the total of the. Now here you see that that area has went away. It has disappeared. Now this I was scanning in patient in left lateral decubitus posture. Now scan the patient in scan the patient in supine posture, and you will see the difference. And ask the patient to take a deep breath and hold it. Lamba saah lena, lamba saah lago, roko, and here now you can see that again you may be confused with this area, but when you see the posterior wall is intact and there is nothing within the lumen, then this area is not the calculi, rather bowel segments. Sakhicho Maji, Sakhicho, Roko, Lamba Salago. Take a deep breath, hold it. Take a deep breath. Okay. Now here it is very much clear that this is the common bile duct, the portal vein, the neck of the gallbladder, the fungal region, and these are the bowel gases. Don't confuse it with, at times it will be cystic with fluid in them. So be aware of this phenomenon, where one should not label the bowel segment as calculi. Now you see here, it seems as if there is a layer of tiny calculi within the lumen of the gallbladder, whereas this is not the case. These are the bowel segments indenting into the posterior wall of the gallbladder. Thank you.